Pioglitazone. It is an oral antidiabetic drug of the thiazolidinedione class used in the management of type 2 diabetes mellitus. Mechanism of action. Pioglitazone acts by activating peroxisome proliferator activated receptor gamma, a nuclear receptor found in adipose tissue, muscle, and liver. PPAR-γ activation is the central mechanism driving all downstream metabolic effects. What PPAR-γ activation does? Activation of PPAR-γ primarily improves insulin sensitivity in skeletal muscle and adipose tissue, allowing the body to respond more effectively to insulin. This leads to increased glucose uptake by peripheral tissues and lower blood glucose levels. At the same time, PPAR-γ activation reduces hepatic glucose production and improves lipid metabolism by lowering circulating free fatty acids, which further enhances insulin responsiveness. The overall result is improved insulin action and reduced blood glucose levels, making thiazolidinediones important insulin sensitizers for patients with insulin resistance. Adverse effects. Starting with the common adverse effects, the first is weight gain. This occurs because PPAR-γ activation promotes adipogenesis, leading to an increase in fat mass. Although insulin sensitivity improves, patients may notice gradual weight gain during therapy. Another common effect is edema. These drugs can cause fluid retention, resulting in peripheral swelling, especially around the ankles and legs. Moving to the important or serious adverse effects. One major concern is heart failure. Because fluid retention can worsen cardiac workload, thiazolidinediones may exacerbate existing heart failure and should be used cautiously in susceptible patients. Another important risk is bone fractures, with an increased fracture risk reported particularly in women, especially with long-term use. Finally, there has been concern regarding bladder cancer. However, this association remains controversial and has not been conclusively established. Clinical uses. The most important indication is type 2 diabetes mellitus, especially in patients where insulin resistance is prominent. Since these drugs improve insulin sensitivity rather than stimulate insulin secretion, they are particularly useful in insulin-resistant individuals. In clinical practice, they are often combined with metformin, sulfonylureas, or insulin to achieve better glycemic control. Another important application is metabolic syndrome. By improving insulin sensitivity and producing a more favorable lipid profile, pioglitazone helps address two major components of this syndrome. A third area of interest is NAFLD and NASH. Although generally considered an off-label use, pioglitazone may improve hepatic insulin resistance and reduce liver inflammation and fat accumulation in selected patients. The key message is that thiazolidinediones are most valuable in conditions driven by insulin resistance, including type 2 diabetes mellitus, metabolic syndrome, and selected patients with NAFLD or NASH. Combination therapy partners. The most common partner is metformin. This is often considered the preferred combination because the two drugs have complementary mechanisms. Metformin primarily reduces hepatic glucose production, while pioglitazone improves insulin sensitivity in peripheral tissues. Together, they provide effective glycemic control without excessive overlap in action. Another useful combination is with sulfonylureas. In this case, Sulfonylureas add insulin secretagogue action by stimulating pancreatic beta cells to release insulin, while pioglitazone makes tissues more responsive to that insulin. Pioglitazone can also be combined with insulin. By improving insulin sensitivity, it helps reduce insulin dose requirements and may improve glycemic control in patients with significant insulin resistance. Benefit versus risk. Starting with the benefits, pioglitazone improves insulin sensitivity, which is its most important therapeutic action. By making peripheral tissues more responsive to insulin, it helps achieve better glycemic control. This leads to lower blood glucose levels without directly stimulating insulin secretion. Another important advantage is a better lipid profile, with favorable effects on triglycerides and circulating free fatty acids. In addition, studies have shown potential NAFLD improvement, making pioglitazone useful in selected patients with fatty liver disease. However, these benefits must be balanced against the risks. Common concerns include weight gain and edema due to fluid retention. More serious issues include worsening heart failure, an increased risk of bone fractures, and the possible association with bladder cancer, although this remains controversial. Key takeaways. The most important point to remember is that pioglitazone remains a valuable insulin sensitizer. Its greatest benefit is seen when insulin resistance drives type 2 diabetes mellitus. By improving the body's response to insulin, it helps achieve better glycemic control and is often used thoughtfully as part of combination therapy with agents such as metformin, sulfonylureas, or insulin. However, successful use requires careful patient selection. Pioglitazone is generally contraindicated in patients with heart failure because fluid retention can worsen cardiac symptoms. It should also be avoided in patients with active bladder cancer due to concerns regarding a possible association. During treatment, clinicians should regularly monitor for edema and assess fracture risk, particularly in susceptible individuals.